I still remember the helplessness, as if it was yesterday, even though 10 years have passed, when I'd gone to see my grandmother, my beloved Nanima, in the hospital. As soon as she saw me, she said, Abha, I'm so thirsty. Can you give me some water? I've been asking for such a long time. No one is listening to me. Why is no one listening to me? I looked around and found the doctors and nurses busy going around with their daily routine. While they came in to give medicines, they had very little time to come and comfort Nanima. But isn't this how our healthcare system is designed? At that moment in time, I realized my Nanima was lying unheard and unseen, very much like the millions of patients within our healthcare system. Hello, everyone. I'm Abha Mehndiratta. I'm a non resident fellow at the Center for Global Development and a faculty at the Institute for Healthcare Improvement. As a part of my WomenLift project, I'm working to catalyze change to redeem the spirit of medicine so that we can build a healthcare system that cares for its caregivers. Because how can we expect carers who are themselves exhausted and unsupported to be able to provide compassionate care? Reflecting on Maslow's hierarchy of needs, we need to make sure that we first take care of both the physiological and safety needs of the healthcare workers in our system, making sure that they have adequate sleep and rest and they feel both physically and psychologically safe. We do know that healthcare workers are at risk to bloodborne infections and often violence at the workplace. The recent incident in Arjikar Hospital in Kolkata brought that horrifying fact in front of us. Also, it's important that they feel psychologically safe, safe enough to speak up or share something that is important to them, or even when they are not sure whether this is the right thing to do and they have the courage to ask. We know that healthcare workers, especially postgraduate students, experience very high levels of stress, and in 1 in 3 is reported to have had suicidal thoughts. This stress not only impacts the healthcare workers but also impacts their interaction with patients and is an impediment to them making connections, being able to develop teams, work with camaraderie, to build their self esteem, and then actually to be able to achieve self actualization where they can do everything that's possible for their patients. So, this affects the patient doctor interaction, which often is exhibited in the form of violence and conflict. And the solution for that, which has been told, is stricter laws and getting more security. But the root cause of this problem, that is really taking care of the needs of the healthcare worker, has often been ignored. And that's why time has come for us to truly redeem the spirit of medicine in India. And that's why, as a part of my Women Lift Health project, I've been working to bring IHI's Joy in Work framework in the country. The framework allows staff to ask questions in terms of what matters to you, to identify unique barriers to joy in their local context, and create a shared commitment to find positive change and apply improvement science to test it and help improve healthcare worker well being. I have been collaborating with the consortium of accredited healthcare organizations as well as experts within IHI to contextualize this framework and create a training module which we'll be soon testing in April in the annual conference of CAHO. I've also initiated discussion with the National Medical Commission on how this framework can be integrated within the medical curriculum, and I've been invited to submit a proposal on how this can be tested further within medical colleges in India. The Women Lift Health journey has been deeply personal and transformative for me. While my Nanima's experience has been a call to action for many years, it's really the Women Lift Health experience which has propelled me forward. Staying authentic to the purpose has really driven me forward, and I've learned how to be inclusive, to bring voices of frontline workers forward on what really matters to them. Being strategic has meant looking beyond a single workshop and engaging institutions like the National Medical Commission to embed this framework into medical education for the long term. And the most rewarding part will be when we get to see the long term impact, healthcare teams rediscovering the joy in care. But this is just the beginning. To sustain momentum, I will need to continue to create collaborations and do advocacy for this work, because caring for caregivers needs to become a priority in India's healthcare system. Because when we support those who heal, we truly create a system that heals. Thank you very much, Women Lift Health, for this opportunity. Thank you.